The Ottawa ankle rules are used to indicate when radiographs are needed for the ankle or foot. Indications for the ankle include tenderness over the posterior edge of the distal 6 centimeters of the lateral malleolus, tenderness over the medial malleolus, and/or the inability to bear weight for 4 consecutive steps. Indications for the foot include tenderness at the base of the 5th metatarsal, tenderness at the navicular, and/or the inability to bear weight for 4 consecutive steps. The test item cluster for patients to benefit from spinal stabilization includes age less than 40 years old, average straight leg raise greater than 91 degrees, aberrant motion, which includes a pseudo-Gower sign, a painful arc, reversal of lumbopelvic rhythm, or an instability catch, as well as a positive prone instability test. All right, I'm going to go ahead and have you put your hips on the table and lay flat. Good. Keep your feet on the floor. Let me know if you have any pain. Out right there. All right, now I want you to lift your legs up off the floor. Good. Has your pain changed in any way? Yeah, it's better. The test item cluster for patients likely to benefit from spinal manipulation includes symptoms less than 16 days, no symptoms distal to the knee, FABQ work subscale less than 19, at least 1 hypomobile lumbar segment, and at least 1 hip internal rotation greater than 35 degrees. The McMurray test assesses meniscal pathology. To assess the medial meniscus, you externally rotate the tibia. To assess the lateral meniscus, you internally rotate the tibia. The anterior drawer test for ACL pathology. The slump test is a neurotension test for the lower limb. Go ahead and put your hands behind your back. Good. Now slump forward for me as far as you can and bring your chin to your chest. I'm going to apply some overpressure, extend the knee, and dorsiflex the ankle. I'll then ask the patient to bring their head up and see if their symptoms have changed in any way. The test item cluster for patients with hip osteoarthritis includes self-reported squatting as aggravating, pain with active hip flexion, pain with active hip extension, passive hip internal rotation less than or equal to 25 degrees, and a positive scour test with adduction. The Faber test may be used to assess the hip joint, the SI joint, or the iliopsoas muscle. The Ely's test looks at rectus femoris tightness, and you would want to compare bilaterally. A patient with gluteal and hamstring weakness would demonstrate the following: weakness in hip extension, hip abduction, and hip external rotation, as well as knee flexion, active range of motion deficits due to the weakness, a positive Trendelenburg sign, where I would have my patient stand on the involved limb and lift the uninvolved limb. The hips would drop for a positive test, and then their reflexes and sensation would be normal. A patient with an L5-S1 radiculopathy may have myotomal weakness in plantar flexion, knee flexion, and great toe extension, as well as sensation deficits in the L5-S1 dermatome. They could have radiating pain in the lower extremity. They could have a diminished or absent Achilles tendon reflex, a positive straight leg raise, where I would lift the affected side, and they would have pain in this leg, a positive well leg test, where it would be in the other leg, and a positive slump test, which was previously demonstrated. They could also have abnormal imaging.